Hello and welcome to the PFFUI podcast. On this month's episode, Chief Medical Director for the Indiana Emergency Medical Services, Dr. Eric Yazel, joins the show to discuss mobile integrated health, paramedic and EMT recruitment, and mental health for frontline providers. Enjoy the show. Hello and welcome to the PFFUI podcast. My name is Eric Shoaib, and I'm joined today by President Tony Murray and Vice President Mike Whited. Hey, guys.
Hey, Eric, how you doing?
Doing great. Yourself?
Good.
Hi, Eric.
Hi, Tony.
Good.
Good afternoon. We are joined today by special guest, Chief Medical Director for Indiana Emergency Medical Services, Dr. Eric Yazel. Hello, Dr. Yazel.
Hey, everybody. Thanks for having me. Excited to be on here today.
Dr. Yazel, please tell us a bit about yourself. Where are you from, and what do you do for a living?
Yeah, absolutely. I would say I have the whole state of Indiana covered. I was born up in northern Indiana in Michigan City and lived in Lake County for a while. And then went to most of my school. I grew up on the east side of Indianapolis. Went to Indiana for undergrad in Bloomington, and then got my master's up at Ball State. And then I've been down in southern Indiana since 1999. So I live a small town called Borden, kind of middle of nowhere, about 30 minutes northwest of Louisville. So kind of been all over, seen the northern part of the state, middle and south. I'm the son of a couple of educators, but I always was interested in healthcare and kind of continued to navigate in that. And once I got in emergency medicine, became a medical director for a lot of different EMS services and kind of developed my passion for EMS from there.
How did you get started in the medical field?
Oh, wow. First job in the field, I guess it depends on how you define that. Probably was a lifeguard, I guess. You know, I have CPR and basic first aid training and, you know, some field management of various injuries through that. I always thought I wanted to do ER, and I had a family friend whose son was an ER doc up at Cook County in Chicago, which is the location where the TV show ER is based out of. And got to follow him a couple times, and I'm like, this is what I want to do. And so just kind of always gravitated towards that field.
So we can safely say that your career as a lifeguard launched your career in emergency medicine.
Something like that. Yeah, absolutely. Well, first time I ever had to do CPR and things, so I guess that counts.
Well, I don't know. I was a lifeguard in high school, and I took a different turn, I think.
Well, I can't say there was a lot of work getting done most days. It was more sitting around and enjoying the scenery at the pool and things like that. So.
Working on your tan. Yeah.
Right.
You and Mike have something in common.
Right.
At the State House today, Mike testified on a bill in committee regarding life-saving personal flotation devices along the lakeshore of Lake Michigan. So
there you go.
Yeah.
Yep.
Yeah. A couple of things there. So Michigan City kid, former lifeguard, and Mike, former lifeguard, former EMT, trying to make people safer along the shores of Lake Michigan. The beaches.
Oh, trust me. I remember there was an occasional drowning when I lived up there, and my parents always told me to have a healthy respect for the undertow and some other things. So I think that's probably a great bill that you're supporting there.
Yeah, it is. And I as a young kid, I grew up in that lake on the beaches, northwest Indiana, and a part of our free entertainment was to find the warm water. Which was discharges really from the mills, and we'd usually find some dead fish, pretty big ones, and throw them at each other. I'm not sure what we were thinking or what our parents made. You know, they think they were ignoring us.
Well, they call it river rats down here when you're out on the Ohio River, and I would assume the cleanliness is probably pretty similar to what you had. So,
What does your job as Chief Medical Director of the Indiana Emergency Services entail?
You know, the thing I like about it most is, honestly, it's kind of a nebulous position. That you can take it where you want to go and develop your own philosophies and things like that. And I'll say, it's my philosophy is a little bit generic to support all things EMS. But what's most important to me is to get out in the field, sit down and talk with the boots on the ground crews all over the state, and make sure I'm representing, that I understand what's going on out there and representing them well as I advocate for EMS, whether that be, protocol development, advocating with legislature, rules and regulations, any of those other things that are kind of the daily functions. I want to do that with a mindset that I'm truly in tune with what's happening out there in the state and all over the state, that north, south, east, and west, that, they know my door's always open or my phone's always on, and that I've been there in person to see what their setups look like, to listen to, the things they do well, to listen to their challenges and things, and develop, my philosophy on what needs to be done from that real world experience.
Yeah, we've had the good opportunity to work with you in your short period of time since you were appointed in this position, but which has been great. I know that you spoke at our state convention last year, addressing our delegates there about the role. But Mike and I actually were part of providing testimony and supporting the bill that created the state emergency medical director, and you're the third in this short period of time. First was Dr. Mike Olinger in that role, and then Dr. Mike Kaufman, and now you're the third in this short period of time. But one of the reasons that we really, from our perspective as PFFUI leaders and working in the legislature, was that this was a really needed position to help guide the future of EMS in our state when that was back. And do you remember what that's?
God, it's several years.
Yeah, it's been several years. I'd say 7-8 years ago now that took place. But we're happy to have you along, and you bring a unique perspective of understanding really all facets of out-of-hospital care, from the basic EMT level to first responder to the advanced paramedic level. So we appreciate everything that you're doing in this role to help enhance and help provide a resource to our members out on the streets.
Well, no, I appreciate it. And it's been a great partnership already. And, I make no secret that I have a strong degree of respect for fire services and fire-based EMS and all the things that come with it. So it's been a great partnership, and you guys have been great to work with so far.
We are hearing more and more about mobile integrated health, but many people have no clue what it is. Could you please briefly explain what mobile integrated health is?
Yeah, so mobile integrated health is basically using the EMS system outside of the 911 realm to deliver care at people's place of residence for an especially vulnerable population. And I know that's kind of a long-winded answer there, but basically I say it's one of the community initiatives where everybody wins. We all have in our communities patients that have certain barriers to accessing the healthcare in a traditional fashion, whether that be substance use disorder or elderly, mental illness, people with, chronic medical conditions that are heavy healthcare utilizers. Those are all populations, that can be well served with mobile integrated health programs. We used to call it community paramedicine, but obviously that led to the idea that you had to be a paramedic, and some care can be delivered at the EMT level as well. And then we also utilize social workers and other professionals. But so it's great for our patients with healthcare vulnerabilities. It's great for the EMS system because you say, okay, these are people who are typically, heavy ER or heavy 911 utilizers, who are strained on the system at times. And this frees the EMS systems up to look at, your more acute emergencies while again still addressing some of those chronic medical conditions with a mobile integrated health program. And then your local healthcare delivery system benefits as well, your hospitals and things like that, because it helps address ER crowding. It helps with ER boarding. It helps with readmissions to the hospital and all those things that help keep your hospitals, financially healthy and healthier, for the community service delivery. So it's a really great system, and it's versatile. You can adjust to a new trend in your community in days, whereas if you're looking at a brick and mortar provider, it can take years. So it's a really nice, cost-effective, patient-friendly way to deliver healthcare in a barrier-free manner.
And I think that we often hear these programs referred to as MIH or MIHP, Mobile Integrated Health programs. And I know that even right now in this session of the legislature, there are 3 or 4 bills that have some component of helping to support or to lift up mobile integrated health cares or MIHPs around. And I know that we have several fire-based MIH programs around the state as well, and more to come. And I think as we help sort of develop these programs through legislative action where we can get reimbursement or get grant programs that are state funded to help subsidize and support these programs, that it's only going to be increase in terms of developing out and really the bottom line, helping people in a different way in the communities that we serve.
Absolutely. Some of our fire-based MIH programs are some of our longest standing ones and some of our most successful ones. And I agree. Right now, we're in a situation where a majority of these programs are grant supported. And we've been fortunate enough to, as legislature looks at, they've increased some of those grants over the years, but we still want a pathway to sustainability so that these, we can do 5, 10, 15-year planning with some of these programs. And so that's where some of the focus has been when we advocate for MIH overall.
And would you agree, Doc, that now these programs have been in existence long enough to where we're able to now capture some meaningful data that we can actually look at and see how effective these programs are and where we can step off into making them more effective or concentrate in areas of need? Would you agree?
Absolutely. I think we've already shown in numerous areas of the state, we've already shown the worth and the value of these programs. Now my focus is more a lot of times on expansion to areas that haven't traditionally had MIH programs, and then also looking for new avenues where MIH can make an impact. I think we've been talking a lot lately about aging in place at home, elderly fall prevention and, helping people with their medications and things like that. I think those are some new frontiers. Some MIH programs are even doing like helping people with their preoperative tasks that they have to do. If you have to get a EKG or some things like that with a procedure coming up that helps hospitals stay lean and efficient. There's just a lot of new avenues that we're looking to. And we have the MIH map that shows the different programs across the state, and each state turns red or pink depending on what you think of the color of the map there. And I'd like to see the entire state of Indiana, be covered with that. And that's our eventual goal. And every few months, a few more counties pop up, and so I think we're rapidly getting to that goal.
Pieces of legislation that Tony was talking about was it starts a pilot program. It's 3 counties to start a new MIH program, and it's also looking at it to measure these programs. So this is a good thing. I think we're heading towards doing it in every county in Indiana.
Absolutely, and they picked some great programs that I think have a strong footprint that are going to be very successful in demonstrating the worth of MIH. So I think we're in good shape there. And I think one thing we've talked about as a EMS organization is saying, let's not just stop there though. Let's get all our programs sharing data, so that we can really say, hey, this is the impact we have, both on our patients, on healthcare costs, on all the different aspects of healthcare that we look into. We want to demonstrate that impact on as wide a spread as possible.
You mentioned earlier 5, 10, 15 years down the road. What does the future of MIH look like in Indiana?
That's a great thing. I think it'll be ubiquitous. I really do. I think as we have our strong MIH programs really integrating themselves to become an essential part of a community's healthcare continuum, that's going to further show people the value of EMS in general and raise the whole field of EMS. I think one complaint we always have is that EMS reimbursement and salaries and some of those things have lagged over the years. This is a new, different way to ingrain ourselves in the community and demonstrate our worth that I think will hopefully in turn help us as we advocate with the decision makers and the purse string holders and things like that to have more value placed into EMS. So I think it's just another way of inserting ourselves into the healthcare continuum. And we're fortunate enough to get to do that while serving some of our community's most vulnerable citizens, which is a pretty noble mission in my eyes.
We oftentimes talk about the workforce shortage. The fire service has seen decline numbers in hiring processes for the last few years. Tony and I as paramedics and Mike as an EMT, we are seeing less paramedics in the field. We're taking more medical calls outside of our districts and receiving more ALS intercepts due to the lack of paramedics on medical scenes. What What are some ways you are addressing the workforce issue?
It's a huge issue for us. All the things that we talk about, all the bells and whistles and programs and initiatives that we want to do, they're all going to be limited in the current workforce environment that we have. One statistic I always throw out there is there are about 4,700 licensed paramedics in the state of Indiana, but only 1,600 of those actually filed a run in the 911 system in the last year. So, I mean, that is an absolutely critical workforce shortage. We recently released a report from the Bowen Center, which is a population health, public health organization out of Indianapolis, that did a very comprehensive workforce study, and again showed some really critical areas of need. So we've got to kind of hit it from all angles. I mean, first of all, I think we need to make sure that we're retaining the ones that we do have, and so working on work quality of life and workplace satisfaction and things like that. But we also got to get butts in the seats. We've got to start reaching out to kids in, 8th grade and start introducing them to the healthcare field and, fostering them, getting their CPR training and, entry-level positions and making sure that there are various training programs all across the state that meet people where they're at in their part of life. I always say an EMT who's 18 with, no other obligations probably wants to pound through his class as soon as possible and get out in the street and start, earning money and taking care of people and putting his skills to practice. Somebody else who's a career change that may have a family of 4 and is working another job, they may only be able to do it, one night a week or something. And then also geographically, obviously the training programs tend to be clustered around our most populous areas. So, you're asking somebody 2 or 3 nights a week to do a 4-hour round trip. I mean, that's a tall order. So we're working on, all things like that, increasing our training programs, increasing how many sites we have. We're supporting test prep to help with our pass rates so that people, when they do finish the class, are able to go through and get their certification. So just a lot of different initiatives that are coming out right now. And we're really fortunate to receive some of the public health funding from the Governor's Public Health Commission this past year. And they've realized that our public health system will never reach its potential without a robust EMS system. And part of that is having the workforce to put those initiatives out. And so we're really working hard to do that. The challenge is that's a long game. Those things won't show up, for a couple of years down the road. So it's still really a challenge to maximize what we are doing right now today. I always say, we'll get you some new workforce in the next few years, but that doesn't help you fill your schedule this weekend. And I think that's the challenge and the crutch that a lot of our services are feeling right now.
If you don't know Dr. Yazel, you would be surprised to know that there's only one of them. This guy does so much and is at a lot of different places, helping to create the discussion, helping to promote EMS and what it is and our all aspects of our workforce, but also to help us to progress. You have a vision, I think, that is just outstanding. And you really are on all fronts of this and really helping to engage people in spaces maybe that have not ever been engaged before. So we do appreciate, the efforts that you put forward and the partnerships that we can create, because I think together we'll be able to help address these workforce issues, these workforce challenges through recruitment and retention and getting more paramedics and EMTs in the field. So thanks for the work that you're doing, because it's really necessary.
No, I truly appreciate it. And like I mentioned before, it's just really important for me to get out and hear what places are experiencing firsthand. There's no substitute for that. I think, number one, it means a lot to somebody when somebody from a state agency comes out to their hometown or wherever that may be, shows interest in learning about their system and things, but also to listen. And I learn a ton everywhere I go. And, again, it helps me to get a feel for what the boots on the ground are experiencing. And a lot of that is, the workforce crunch and things like that. And also just I'm still actively working in emergency medicine. And so I see that side of it. They deliver patients to me just like they always have, and learn a lot that way too about what we need to do out there. So,
yeah, I know you're well thought of in your ERs that you're treating patients and meeting EMS folks as they come in and bring you patients.
It's still part of what I love. It's funny, every once in a while when I'm on a site visit, they'll say, hey, we're getting ready to go out on a run. Do you want to go? And I always can't jump in the truck fast enough. So It's always extra brownie points when you load me up when I come visit.
One of the growing concerns in the fire service and EMS is mental health. How is Indiana Emergency Medical Services addressing mental health for providers?
That's a great question and something I'm passionate about. I also do some work in the mental health field. And I always say for the first responder community, for lack of a better word, we do everything ass backwards. We say, here's this career where you're going to go out there and you're going to see, things that no person was meant to see. And then 6 months, a year, 10 years, whatever that looks like, when you have, when it starts to kind of build up on you and you struggle with it a little bit, then we'll tell you after the fact how you should have processed it. And, that this is obviously that's not an efficient way to do things. And so one of the things we've really been looking at is comprehensive mental health support for, fire, EMS, and what that looks like. What are the essential components of that? And I think there's a lot of things. I think there needs to be some pre-employment, training, some resiliency training, some things like that, just to say, hey, here's some things you're going to see. Here are your options. And, this is how you might feel and how to deal with that. I think peer support is a big part of that, always has been. I think that that other things that you look at as well are virtual options. I think it's, we're not a 9 to 5%. We're not a 9 to 5 profession. These things happen after hours, 2 a.m, things like that. So having some virtual availability, especially in our rural areas. Critical incident stress management. When we see something especially traumatic, that we have, resources that are available in real time, and just some of those comprehensive things that's a continuum of care for our mental health professionals. And again, when you talk about legislative side of things, this past session, I think there were several bills that kind of started out in that mental health first responder arena, but there wasn't really something concrete that people could grasp onto and carry that to the finish line. So I think the onus is on us to say, hey, here's what we need as a profession, and let's advocate for that. And I think we'll have a receptive audience in order to make that happen.
Yeah, and there's a lot at play right now, and I would say that from our perspective, the priority and the foundation of why we exist as a union is to address the needs of our members. And the mental health challenges and the stress and the struggles is nothing new in this profession. But about a decade ago, from our union perspective, we decided to take this topic out of the shadows and actually start dealing with it and building resources around our members to now sort of have wraparound resources and identify and at least talk about the issues, that you mentioned, Doc, that come along with this job, and no longer ignoring those, but saying, how can we help foster this? What can we do to prevent? What can we do to treat? What can we do to keep, this cumulative stress from debilitating our workforce? And, we're building these programs. And I think one of the bills that became law last session was that required training for first responders, police officers, EMTs, paramedics, and firefighters, one initially as their new employees, but also annually. So that currently that process is being built out now by the agency IDHS and law enforcement to then to deliver this education, suicide prevention, and mental health and behavioral health strategies to be better and to treat those things. So we're pretty, I think that we're pretty lucky to have a very supportive group of people, both in state government, state agency, in our locals all around the state, and our international local in this state union that have partnered and come together to say, let's make the health of our people a priority as well, and that includes mental health.
Absolutely. And I think that is as commendable as it gets, because we're not traditionally a profession that, accesses the mental health system very well or very efficiently. I think there's still a lot of stigma associated with it. And so I think having these discussions and having, comprehensive availability of kind of a, not a one size fits all, like everybody has to do this one thing, but having a comprehensive, smorgasbord of options for somebody who is having some struggles, I think that's obviously crucial to the overall health of our providers. And so really excited to see where this is going. I've met with several people from like our Division of Mental Health and Addiction of the state about what these programs would look like and kind of developing a best practices sort of model for this. So really excited to see where this can go, because, you know, it's just got universal support, and it's obviously a critical need.
Well, and I learned through this conversation that you dabble in some behavioral health treatment. So I'm gonna probably have to talk to you, schedule some time.
That'd be awesome. Yeah, I'm the LifeSpring Health Systems I work for them. They're a community mental health system. I'm their chief medical officer, so I dabble in that a little bit as well.
Very good.
Yeah.
Dr. Yazel, today I ran into Representative Rita Fleming, and she was talking about a program that's fairly new, and she said you were passionate about it. I told her we were going to be doing a podcast with you later. It's a program called Handle with Care, and I'm sure a lot of our listeners out there don't know what this program is. Can you kind of explain what it is?
Yeah, absolutely. Representative Fleming's been a huge advocate of this program, and she's a wonderful community advocate for a lot of healthcare areas. So we're lucky to have her. She's from my neck of the woods, and there's a program called Handle with Care, which basically what it is a first responder or, you know, invested community member can notify a school that a child has experienced a traumatic event. So say a child has had a domestic violence event in his home that, you know, was it up all hours of the night with that, and police involvement or EMS out in the scene, things like that. They can send a notification to that child's school. It maintains privacy. It just says, you know, Johnny is handled with care today. So that, you know, if he's sleeping in class or, you know, doesn't have his homework done, that, you know, honestly, so they cut him a little bit of slack in that scenario. And, you know, when a kid has had a challenge like that, I think that's just a really, really good way to help a student not feel like the whole weight of the world's coming down on him when he's experienced a traumatic event. And, you know, I think a lot of times our first responders are on scenes like this where your heart goes out to children that are on the scene and things, and you wish there was something that you could do to help. Well, this is that modality to get there. And we're really passionate about trying to get it up and running countywide in our area. We have some of the school corporations invested in it, a lot of our first responder community, and really would love to see this kind of pop up. Several areas of the state are doing this well already, but really would like to see it, you know, kind of pop up all over the state. I think it's a really great program.
I think we're going to find out some more information on this. We've got our convention coming up here in a couple months, and we're going to have representation from most of Indiana there. We'll get the word out to our members on this. This is a program that they could start using.
I think it's awesome. I think it's a natural partnership with some of the fire services, especially fire-based EMS. Again, you know, you may not be out on the scene for, you know, the child themselves, but something's going on in that house where the child will have been up all night or things like that. It gives you a means to help that child even when you're not physically on the scene there. And I think that's a noble cause.
Dr. Yazel, we will get you out of here on this question. Indianapolis EMS resuscitated a trauma victim in the field using whole blood. What are your thoughts on EMS crews carrying whole blood for resuscitation efforts in the field?
Well, you saved one of my favorites for last, to be honest. You know how they make the jokes about, like, vegans talk about their stuff or CrossFitters talk about their stuff. If I'm not going on and on about MAH, I'm going on and on about pre-hospital whole blood. There's some
the bread and butter of EMS.
There's some systems that have done it very, very well. San Antonio, Miami, and it's really been game changers for their community. But what excites me is those are areas that are very urban and have relatively short response times. What we haven't seen is widespread whole blood pre-hospital ground EMS use in places that are a little farther out, your 15, 20, 30-minute response time areas. You know, I would say the perfect place are those ones where if you have a bad trauma, you're like, should we fly this or just, you know, put the pedal to the metal and try to get to our trauma system center as soon as possible? And I really think that's where a lot of the potential life-saving is right there. And, you know, Indy EMS has done it with some of their tactical stuff. I think that's great. We have a couple of programs at Newcastle and Crawfordsville who are carrying pre-hospital whole blood. And what I would like to see is all the trauma centers maybe partner with a system or two, an EMS system or two as a pilot, so that we have different variations of this program all over the state, and we can begin to collect data to show that there's a benefit there. And, I really think this is probably the biggest advance we can make in pre-hospital trauma care of anything we could be doing. So I'm really excited to see the uptake, the interest. Every time I mention it at any kind of state meeting, I get 3 or 4 services that are like, we want to do this. Where do we start? And things like that. So I do think, we have a few pilot programs now, but I think you'll start to see those pop up all over the state. And that's a really exciting thing for me.
And this is the bread and butter type of thing that trauma for EMS providers. And, as we begin to wrap up, and it's been a great opportunity to talk and learn a little bit about what's going on in EMS around Indiana, and to have you on board. Part of that, I think, and I interact with you on a regular basis because of PFFUI. We are engaged on a variety of levels, really all levels of EMS, and our members are out on the street. We've got first response, really over 90%. Are making first response calls, and we're 85% doing out of hospital care and transport, 911 side of things across Indiana. So we're really part of every conversation when it comes to the trauma system, which we had great progress in Indiana building out the trauma system, but looking at also the vision for the future as it pertains to EMS. And we've been working through a series of workshops, and we're glad that there's a lot of different representation, not just from the PFFUI, but from all areas of public safety that have been part of those meetings, and in the medical community as well, and public health. So we really appreciate working with you to make advancements for our Hoosier state.
No, I appreciate the working relationship we have, through the Fire Alliance and PFFUI. I mean, I've just had nothing but wonderful interactions, and, the shared vision for where we think EMS can go in the future is great. And I just think there's never been a more exciting time. I mean, we're not without challenges. There's no doubt about that. But, as you mentioned, there's more and more legislative understanding, community understanding of what needs to be done. So I do think, we're starting to get the tools that we need to make those changes, to make the EMS system in Indiana reach the potential that it has. And just a really, really exciting time across the boards.
All right, Dr. Yazel, well, thank you very much for your time today and for joining us on the show.
No, I really appreciate you having me. It's been a pleasure to talk to everybody.
Thank you for taking your time.
All right. Thank you.
Thanks, yes. Thanks, everybody.
Thank you for listening to the PFFUI podcast. Follow us on social media by searching the Professional Firefighters Union of Indiana. For more information about news and upcoming events, visit www.pffui.com. Until next time, this is PFFUI Communications Director Eric Shoaib. Stay safe.